This video is about the A, B, C, D, E's of melanoma, so that you'll be able to identify a melanoma on your own body right at home. So a good place to start would be to talk about what exactly is melanoma. So melanoma is a skin cancer that comes from the cells in our skin that give our skin color. It's the sixth most common cancer in the United States. And it can show up anywhere on your skin, even in places that don't usually get exposure to the sun. So what exactly do melanomas look like then? Well, the A in the A, B, C, D, E's is for asymmetry, which is when one half of a mole doesn't look like the other half. B stands for border, which is when the edges of the mole are irregular, not clearly demarcated from the skin around the mole. C is for color. Moles should be the same color throughout, but melanomas can be multiple colors. D is for diameter, which is a fancy way of saying size. Normal moles are usually smaller around than about the size of a pencil eraser. And E stands for evolution, or evolving. And if you have a mole that starts to change over time, change in shape, color, or any of these other ABCDs, that should raise some concern in your mind. So the next natural question then is, who's at risk for melanoma? And quite a few people really is the answer. Generally, about 1 in 37 men will get melanoma, and about 1 out of 56 women will get it as well. So folks who have intermittent but intense sun exposure also are at higher risk for melanoma. So people who work outside in the sun every day are actually at lower risk for melanoma than someone who goes outside, 1 or 2 days on the weekend, and that's all they get every week, and they get a sunburn every time they go outside. Last but not least on this slide is tanning beds. Now, tanning bed use is definitely a risk factor for melanoma. In fact, if you've ever used a tanning bed at all, you're at a 16% higher risk than someone who's never used one in their life. A few more risk factors to talk about. If you have more than 50 moles on your body, you're at increased risk. If you've ever had melanoma before, you're at increased risk. If you've ever had any other kind of skin cancer besides melanoma, you're at higher risk for melanoma. And the last group of people are people whose immune systems are not working well. So these would be people such as cancer patients who are on chemo, patients who've received organ transplants, or patients with HIV or AIDS. So how do you lower your risk for melanoma? So sunscreen is kind of the #1 recommended way. And the American Academy of Dermatology says that we should all be wearing SPF 15 sunscreen every single day. And if we plan to go outside and get sun exposure, we should wear SPF 30. You should absolutely avoid using tanning beds. Cover up your skin with long sleeves, wide-brimmed hats, things like that. And to stay out of the sun between the hours of 10 a.m. and 4 p.m. because those are the times of the day when sun is most intense. And last thing on the list, just a friendly reminder that water, snow, and sand all reflect sunlight, and it's easier to get a sunburn if you're around one of those things. And last but not least, how can you learn more about melanoma? You can always go to the American Academy of Dermatology's website, or other reliable sources of healthcare information, such as mayoclinic.com. And I've also set up a website with some links, and that's abcmelanoma.weebly.com. Thank you very much for watching. Stay safe out there in the sun, and I hope these rules are helpful for you. Take care.